Brady, could you give me soft lighting and sort of, I did ask for hair and makeup but got declined. Toni, clinical coordinator and team leader of the Mental Health Family and Carer team. Yeah, so Safe Haven is an amazing initiative and it's fairly new down here in the Illawarra. And it's a cottage. So someone, say, is struggling with their mental health and feels at risk, feels like life's not worth living. Instead of presenting at the emergency department, having to often wait for hours after being triaged, waiting for all of those backdoor corridors that are coming in through an ambulance and not being seen by someone, it can feel really confronting and overwhelming to someone that has those thoughts going on. So the Safe Haven Cottage is just down the road from the hospital. It's not clinically run. It has peer workers, so people with a lived experience work with the Stride organisation. And it's an opportunity to come into an environment that's a home away from home. I'm not sure whether you've seen it, but for those people that haven't seen it, it would be, it's really important to have a good understanding of it. It's an environment where they are welcomed in. Families have said that it's refreshing to take their persons there where there's not a long wait line. They're being offered a cup of tea, they're welcomed in, they're sat, it's comfortable, it's warm, it's inviting. And the other good thing about Safe Haven is that they have a direct pathway as well. So if that person that had come in, if they don't feel that they can assist and help the person adequately, then they can ensure that there's a smooth pathway referral process up into the hospital for clinical intervention. So I think from hearing back from Stride also that initial greeting, if a person has to go back, it can be quite nerve-wracking, it's quite anxiety-provoking, not only for the person that is really struggling with their mental health, but also for their families, for their support systems. But hearing afterward, it's been so inviting and so comfortable, and having someone that has perhaps walked the walk of having those feelings before just provides that level of hope that, yeah, it feels awful at the moment, but you can get through that. And the same for their families and carers. And often the carers are now knowing that it's open and can take their person, and if they've already gone in and done the meet and greet, sometimes it's just a drop off, and then letting their person have that time there to talk with like-minded people and get the supports that they require and deserve.
That was perfect. Is there anything else that you would like to
Thank
add?
you.